Hello again, everyone. Mark Macomb, Macomb County Executive. John Paul Rea, our Deputy Executive, just giving you updates what we got going here in Macomb County. John Paul, where are we at with the numbers?
Cases continue to climb in the county, Mark. Right now we're at about 4,000 cases in Macomb County, and we're reporting 362 deaths. Statewide, numbers are increasing a bit more quicker than what we're seeing here in the county. Over 29,000 cases statewide and nearly 2,100 deaths throughout the state. So still really focused on that stay home, stay safe, save lives order, social distancing, personal responsibility. But when we look at the larger picture, both not only across the nation but here in the state, Southeast Michigan continues to be the hot spot.
And the interesting thing people talk about is those, I guess, the cases that we're aware of. And they call it kind of the tip of the iceberg. So right now there's 4,000 here in Macomb County, but they know there's far many other people that have already contracted this or probably have had it or connected with it. And so now they're trying to figure out how do they track what's called probable cases. And our health department is going to be inundated with that responsibility. What do we mean? Well, if you got 4,000 people testing positive, they've got to track back to each one of those folks and find out who their contacts were. And then if any of them showed signs or symptoms, trying to tell them to self-isolate, but then find out who they had contact with. So from an investigative perspective, that is really resource intensive for our health department, and we're trying to figure out how do we manage that? Any county who's been inundated with cases is going to have an incredible responsibility to figure that out.
It will be a burden, Mark. Undoubtedly understand how this virus continues to spread throughout our community, but also understanding the symptoms. You know, we've talked about the whole notion of doing those things where you're screening yourself, not just the temperature, understanding what the symptoms are on that side, the aches, the pains, the cough, the sore throat, all those things that come into the whole amount of information that the CDC is releasing on there. But now wanting to put a metric on that, it'll be interesting not only how it's going to help us respond from a care perspective from the hospitals, but also from a tracing and a community engagement perspective, and how that goes into a larger conversation about personal responsibility.
And it also adds to the I guess confusion and the conflict we're having is so when we start getting back to work again, when we start getting back to normalcy, because now if all of a sudden the projection moving forward with this apex or trying to peak as far as the numbers, if we're starting to figure out now are we going to add to this layer of probable cases, are we now creating a bigger mountain to climb here before we start seeing a leveling off and this decline where we can start to get back to normalcy. So it's going to be interesting to see how this plays into it, how it factors into people's mindset, the psyche, and this community spread. If it's not just the cases that are testing positive, but the probable cases too, this could be a long-term impact it's going to have before we get back to some
mitigation and management, Mark. You want to mitigate the spread, and then whenever the virus does arise, whether it's a peak, whether it's a concentration, you want to manage it with the resources that we have. It starts with testing. It goes, unfortunately, with care with those that contract the disease, and on the long end, it goes into the whole notion of as the conversation going with opening up America and what that looks like too.
And what they're trying to do is this, this fact-based, science-based responsibility as to when we decide, we're going to start moving in that direction. So, talking about what just happened with the federal government, the discussions, from their experts as to how do they give some guidelines to the various states. And I understand that that's what the president now is doing. President Trump is saying, he's relinquishing that responsibility to the states, which I believe it is their responsibility to decide that. And even if it's kind of a regional state effort, trying to figure out when do they see, that there's going to be this trajectory where it's starting to decline, and they're given guidance as to 14 days. So the whole idea is, how do they get to this pathway into that? Are they making a determination? Is it some gateway entry into each phase? So they have 3 phases that they put into this. We're going to have this information available on macombgov.org, so you can actually look at the recommendation on behalf of the federal government for the states to guide by. But it's not something just for the states. I think it's going to be individual businesses and even governments like ours. As we start to see that decline, and now we're realizing we can enter into that phase 1, that gateway, because of the trajectory of a 14-day period, the state's going to lead that, make a determination, okay, certain businesses can get back to normalcy, but phasing in what they're going to be doing, and I guess, if you will, giving some more guidance and more, specifics as to what they can or cannot do. Even individual contacts or group settings, all that's going to come into play and it's going to be phased in. I think it was a good idea to give us some guidance, not only for states, but even for businesses and government entities as we start to see where we're heading into that path where we can start to bring some people back to work.
Mark, you've always talked about relying on the experts, and I think one of the pivots that we've seen not only from the White House is this release came out in conjunction with the CDC. What it really focuses on the up-to-date data and the readiness. How can we respond? It looks at the mitigation and the risk of the whole notion of whether it's just for your business or a county or a state. And then I also think it protects the most vulnerable populations. That's always been one of the things that we've talked about since not only we've started doing these videos, but since our health department got information out there with our senior citizens in those areas that we know don't have the resource rich, and then implementing those county-wide strategies, those region-wide strategies, or even those industry-based strategies, whether it's spacing out, factories and things of that nature.
And the plan itself calls for, if there is a resurgence. Let's say you enter into a phase and we're starting to bring back certain businesses and you're allowed to bring certain people back into the company itself, and they got to wear masks or whatever requirements are. And even individuals with getting out, maybe facilities that are open, if it's maybe some kind of a gym setting or some hair cutting opportunities there for people to go back to work. If there is this resurgence, they start to see the numbers start to escalate again. That's when they start reverting back to that very phase that they just came out of. So interesting to see, and I think it was a good idea. And I credit the president for listening to the healthcare experts in this particular situation. I know it was questioned before as to this need to let's get back to work, let's get this country up and running again. No question about it. The economy is struggling. It's going to be a challenge. But health and the human factor is number one, and we've got to be very much concerned about that. I think he sees that. I think now we're starting to see the president is at least leaning on the experts, and I think that's what came out of that with these suggestions, if you will, for states as to how they can start migrating towards normalcy someday.
Absolutely, Mark, and it's interesting to see states coming together too, looking at more regional plans and strategies. But as you said, this is kind of that a la carte menu of ways to restart our economy, re-engage society, and understand how we can still manage this virus, but giving people that latitude to come back in.
So if you want to take a look at that, macombgov.org, go ahead and click on the access information we have for this COVID. It's going to have that detailed explanation as to what we're talking about here. But again, I just look at it as basically a guideline. They're not trying to tell the states what to do, just maybe guide them. With that being said, we talk about manufacturing, getting people back to work, and we're seeing many companies are trying to figure out how do they kind of retool themselves in the midst of this crisis. We are known as the arsenal of democracy here with manufacturing. The whole idea, we can design, engineer things, and we've done that ever since the war efforts and the automotive industry and the healthcare industry. A lot of things that we do here, Southeast Michigan has been known for that, and here we're starting to see that, if you will, arsenal of democracy turned arsenal of innovation, and now arsenal of health. Some of these companies that are making masks, the N95s in particular, the shields that they're looking for, and they were in such demand, our healthcare professionals and our first responders. And now the gowns became a concern. And here we've got a company in Macomb County, Cadillac Products, that reversed engineered an actual gown. And I think they did it for, the altruistic idea that, they want to help out. And in particular, somebody's cousin who worked at one of the hospital systems says, we're in need. And so they did. They came together, opened up the shop, retooled the shop, and made these gowns. And I'm going to tell you, extremely professional gowns that they're just knocking off and getting out there to the healthcare professionals. I was incredibly impressed by the work that they did.
Mark, those examples are not only all over Macomb County and all over Southeast Michigan, but across the country. It's using that innovation, that concept to consumer mentality, that whatever the challenge is, whatever the product's needed, we have that manpower, we have that horsepower here in Southeast Michigan, and now we're getting those resources to the most critical needs throughout our community in the healthcare field.
It was interesting, the general manager, Mike Williams, he was the guy that kind of pulled this together. It's a fourth generation, by the way, this company, if you stop and think about that. They were around back when the war effort was here, the arsenal of democracy, and here they are still in play. And again, that first gown, I think you mentioned it took them about 50 hours of work to I guess, if you will, reverse engineer and figure out exactly how they wanted this thing laid out, retool their shop to get this thing played out. And they're actually pressing, 60 gowns at a time. Within less than a minute, they're making 60 of them. So they're going to be putting out about 600 of these gowns every hour and getting them out there to healthcare professionals. So, credit to them. And I think they're going to be helping us with some of those gowns for our Martha T. Berry facility as well. So.
Mark, it's been great too, even from our EOC, as a need for personal protection equipment has come up, whether it's working with suppliers that are here within our region, whether it's reaching out to the national stockpile options that we have to, engaging with the state EOC. Our team has been able to access these resources and get them back to the county. We're looking at ensuring that at least we have a 3-month stockpile as we look at how these things start to ramp up and tracing this virus, not only into the summer months, but as we head into the fall. And it's one of those things right now that we've got a system in place. It's working for our community, and now we're bringing businesses into the fold to help us make sure that that need will always be met.
And interesting to see how many people want to step up during this crisis to be a part of the solution. And we want to thank you once again for tuning in. We just want to once again share with you our thoughts and tell you, continue to be part of the solution, be patient, but also keep yourself and your family safe.